Fibromyalgia. So you may be told you have fibromyalgia. You got a lot of pain and it's in a lot of places. What is fibromyalgia? Pain in a lot of places. Widespread musculoskeletal pain. What's musculoskeletal? Well, that's in your body, in your muscles, in your joints. Well, that's where pain comes from. So when you have widespread pain and it's hurting in a lot of different places, you may eventually get to a doctor and he makes you feel somehow better, that he gave you a Latin sounding name for your problem, and he feels like a hero because he was able to give it a name, and he told you you have fibromyalgia after you told him, I hurt in 6 major places all the time, or much of the time, and it's stopping me from life. Well, he tells you got fibromyalgia, which means you have a lot of places that hurt and nothing more. It doesn't mean he understands the cause or really knows how to fix the cause. In fact, he doesn't. What's he going to probably do for you? Write you a prescription for drugs. 1 drug, 2 drugs, 3 drugs, more drugs. You can have drugs that are for pain killing, all the way up to and including the most severe and even addictive ones. You've got drugs for the depression that many fibromyalgia people experience. So you've got wonderful psychiatric drugs that are designed to take away your depression, but they tend to take away some other things too. Drugs all have side effects. I think everybody smart knows that. And it isn't a secret. I mean, look it up. Drugs all have side effects. The question is it worth the side effects to get the result? In the case of fibromyalgia, you're just spray painting over the symptoms of pain. You're never fixing it with drugs. There are no drugs that have ever been used in fibromyalgia that make it go away unless you keep taking the drugs to cover up the symptoms so that you feel it less. And even then, they don't tend to really work and the side effects are so bad. So you can have pain in your neck, you may have pain in your back, your spine, numerous joints. It could be your right ankle, your left knee, your right wrist, your index finger, the base of your thumb, the base of your skull, your whole head hurts, you've got headaches, you've got migraines. You don't have to have all of these things, but you have to have a number of them usually to qualify for this diagnostic word fibromyalgia. Well, what is fibromyalgia? I've treated so many of them. We've been able to get people completely out of pain, completely back to life. They couldn't walk, they couldn't ride a bicycle, they couldn't play a game of tennis, they couldn't take care of their job, they couldn't take care of their kids, they couldn't take care of their house. And now everything is working and the pain is gone. And how do we do that in a matter of weeks? By finding out and understanding what causes fibromyalgia and fixing the cause, not just spray painting with drugs over the symptom. What's the cause? There are 2 areas together that cause fibromyalgia. Area 1 are your glands. You have burnt out glands. In every case I've fixed that's come in with fibromyalgia, and we fixed everyone, we take an examination of the patient and discover that they fail adrenal tests. Their adrenal glands are shot, they are exhausted, they are fatigued to the point of exhaustion. They just can't work. They're not putting out hormones, and because one of their main jobs is keeping you out of pain by suppressing inflammation because you've got the right amount of hormones from the adrenals, you get widespread pain. But you also get people who enter this ligament stretch syndrome area where we test them, muscle test them, give a quick tug along the arm and retest the arm and it crashes like a stone. We test a leg and we test its strength, we see it's strong enough and we give a quick tug and retest and it goes suddenly very, very weak right after that tug. That shouldn't happen, but what's happening here is that the body is giving you a response that it says, I feel I was injured. I just had a little tug and I feel like I am probably injured, and it goes weaker for a moment. You shouldn't fail that test. Your body shouldn't feel like a joint could be injured from a little tiny tug. But that's what happens when the adrenals hit ligament stretch syndrome, is they become so weak that their joints really are getting injured, which takes us to the second part of what causes and makes up fibromyalgia, and it is joint damage, joint injury. These areas that hurt are really hurt. They've actually been hurt. When you're in ligament stretch syndrome, you're sort of like a chicken. You were cooking chicken soup and the meat is falling off the bones. In this case, the low adrenal function is causing the ligaments to be absolutely at risk of being injured from doing next to nothing. You step a little wrong and you could injure your ankle. You twist your knee and you could injure your knee. So you have to then be able to As you bring the adrenals up to the point where your body can start to heal its ligaments, now you've got to fix the problem at the base of the skull, the problem in the carpal tunnel, the problem that's in your elbow or in your shoulder. Maybe 2 of the elements of the 9 elements of your shoulder that can be damaged are damaged, and that's enough to mess a shoulder up completely and have it in constant pain. But someone has to know how to fix those 2 elements, identify them, and correct them. A very specialized field in chiropractic, not just spinal chiropractic of people who know how to take care of necks and low backs, have ability, training, experience to be able to fix a bad wrist problem, a displaced elbow problem, which can be either of the bones in the elbow, twists in the knee, mistracking of the kneecap, cartilages that are out of place in the knee, metatarsal bones, long bones inside the foot that are out of place that are messing up a foot or ankle. Each of those things has to be corrected, and then they have to heal. So we use not only the adrenal supplements, of only which very few work to get people out of ligament stretch syndrome, and don't think that whole adrenal gland where it's got hormone content in it is the right choice. We don't find that gets people healed at all. We've got to have no hormone content in our adrenal supplements, and then we've got to be able to fix the joints, move them into place, and then the joints have to heal. Do they heal overnight? Do ligaments rebuild overnight? No, it takes weeks. And that's why it takes weeks to fix for good a fibromyalgia patient. Now, sure, I get some of them that are feeling so much better in the first 1 or 2 weeks that it's just like a miracle. But at the end of the day, all of them need to heal. Every joint has to heal. Now, the 2 problems feed off of each other, because when you have low adrenals, which comes from mental stress, emotional stress, blood sugar stress, but pain is a stress. The depression is a stress. Being pained so much that you can't perform in life is a stress, and all of those take a toll on the adrenals. So in this case, problem 1 is worsening problem 2. Your adrenals are worsening your joint problems, and your joint problems are worsening your adrenals. You have to fix both if you're going to get out of fibromyalgia. Now, you would think if it's 50% part A and 50% part B, if I fix part A, I should get 50% better, but it doesn't work that way. You fix 1/2 of this problem and just get the adrenals doing better, and the person doesn't really get well because you haven't healed their joints. You try to heal their joints and ligament stretch them, they won't heal anyhow, but let's just say you were able to heal them, but you didn't fix their adrenals, you wouldn't fix the inflammatory part. So you have to fix both to fix one, and you've got to fix both to fix fibromyalgia. You've got to get rid of the angry nerves, you've got to get rid of the pinched nerves, you've got to correct the damaged joints, you've got to first kickstart and rebuild the burnt out glands. That's the key to actually taking you, a person who was given the diagnosis fibromyalgia, who has so much pain that your family doesn't want to hear about it anymore, you don't want to talk about it anymore, you're wondering whether people think you're crazy because you've been talking about being in pain so long, so much, and where is all this pain coming from? And then getting rid of it for good and for all. Fibromyalgia patients I've fixed years ago send me new ones every week. They're not needing to be fixed again because we fixed the problem and it was able to stay fixed. And that's what you want if you have fibromyalgia.